Though individual choices can impact cancer risk in Iowa, what we ultimately need is a government that cares more about our health than profit, and our Republican-dominated state house is arguably pro-cancer by how little they seem to care about doing something about it. So this video is going to tackle what we can do about Iowa's top 3 most common cancers. First up, prostate cancer. Each year, Iowa farmers use a tremendous amount of pesticides and commercial fertilizer. Research has linked pesticide exposure to disproportionate rate of prostate cancers among farmers, and exposure to nitrate in drinking water is a risk factor in many of the same high incidence cancers that make Iowa's cancer rates high. Yet Iowa has taken virtually no regulatory action. Here's some proven ideas that could help. Mandate buffer strips along waterways to slow the runoff into streams. We don't need to farm every inch of our land. We don't need to farm in flood zones. We could limit fertilizer application during vulnerable weather periods to avoid heavy rains flushing chemicals from the field. We could require proper manure storage and application timing. Reminder that Iowa's animals produce more manure than any other state in the United States. Limit pesticide use near schools and residential areas. End the moves to defund the state's water quality monitoring system. Increase financial penalties for agricultural operations that exceed pollution thresholds, just to name a few. Next up is breast cancer. Research shows that most women who develop breast cancer have no family history of the disease, suggesting environmental factors play a significant role. One study found that air pollution, particularly lead and mercury, were tied to a greater chance of developing postmenopausal breast cancer. Nitrogen dioxide exposure, which is associated with traffic-related pollution, was also associated with increased breast cancer risk. Most of these issues are associated with urban areas, which are also correlated with higher rates of breast cancer in Iowa's cancer registry data. Here's some places regulation could start. Limit or label endocrine disrupting chemicals in consumer products. Prioritize development that doesn't rely on cars as a primary means of transportation. Fund projects that enhance air quality monitoring, particularly for fine particulate matter. Then there's lung cancer. To state the obvious, one of the leading causes of lung cancer continues to be smoking tobacco. The good news is we already have some well-tested means of reducing smoking rates. Between 1963 and 2006, the number of packs smoked per capita in the United States was cut in half, partly due to anti-tobacco campaigns that began in the 80s. Weird. Regulations can't work. Peer-reviewed studies showed that increasing tobacco excise taxes is an effective way to reduce tobacco use, and Iowa hasn't adjusted its tobacco tax since 2007. But any serious effort to reduce lung cancer rates in the state of Iowa also needs to address radon as a major cause. Radon causes about 21,000 lung cancer deaths in the United States each year, and is the second leading cause of lung cancer after cigarette smoking. In Iowa, this isn't just a statistic. 70% of Iowa homes have elevated radon levels, according to the Iowa Cancer Consortium. Every single county in Iowa has the highest radon risk level. So we could require landlords to allow tenants to test for radon and break leases if levels are dangerous. We could require new homes to include passive radon mitigation systems during construction. We could just fund radon testing. We already do that a little bit, and we burn through all the resources very fast in Iowa. This is just some ideas for Republicans to ignore when Iowa has the highest cancer rates in the United States. Read more over at Iowa Starting Line. Thanks for watching.